In jaw surgery, especially the operations we perform, our surgical spectrum is very broad. These, if we need to list them from smallest to largest, we can say chin tip aesthetics, enlarging or reducing the chin tip, for instance, filing it down when reducing or placing an implant when enlarging, or bringing the lower jaw or upper jaw forward, backward, or doing both. Another surgery we perform is related to jaw joint issues. These could be joint problems arising from dysfunction, that is, due to pain, or it could be due to the jaw joint completely fusing with the skull, resulting in the jaw joint not being able to open at all. Another surgery we perform is distraction osteogenesis, also known as jaw lengthening surgery. Now, I would like to provide some brief information about these surgeries. Our primary concern in chin aesthetics is purely aesthetic. A person's chin may be small, it may be large, it may be forward, or it may be recessed. We can make changes to the chin in all three spatial vectors, namely the X, Y, and Z vectors. For example, in a patient with a chin that is forward, large and elongated downward. By filing down the chin and removing a bone piece of appropriate size, we can achieve an ideally proportioned chin. Of course, in chin aesthetics, we particularly want to ensure that there are no issues with the relationship between the lower and upper teeth. If there is a problem with the relationship between the lower and upper teeth, then it is necessary to move on to different surgeries rather than chin tip aesthetics. These surgeries can be described as either the lower jaw or the upper jaw being moved forward or backward, either individually or in combination. We have two main goals here. The first of these is to solve the aesthetic deformity on the patient's face, the aesthetic problem the patient feels. Another goal is to bring the relationship between the patient's lower and upper teeth, that is, the bite, to its proper state. This is the normal bite that should be. The lower teeth should touch the very inner part of the upper teeth slightly. Therefore, especially in cases where the lower jaw or upper jaw is either forward or backward, addressing both your aesthetic concerns and the issues related to your bite requires solving the problems related to their relationship with each other with equal importance, so that you can be both aesthetically and functionally happy and content in continuing your life. We frequently encounter issues related to the joint, particularly in the jaw joint. There are primarily two issues. The first of these is the pain problems in the jaw joint, which we refer to as dysfunction, or the clicking sounds coming from the jaw joint while chewing. In these cases, we examine the patient's findings. In light of the MRI findings, if possible, we first try to address the jaw joint pain issue with non-surgical options. We try to resolve it. These may include medication use. For patients who grind their teeth, there may be night guards to use while sleeping, and there may be physiotherapies. If from these treatments we did not benefit effectively, and if there is significant damage to the joint disc in our MRI findings, if there is significant damage to the joint ligaments, then we need to perform joint surgery to resolve the jaw joint dysfunction, and in any case, we can solve your problem. Another issue we frequently encounter in the jaw joint is particularly the fusion of the jaw joint to the skull following trauma. In this situation, the patient cannot open their mouth at all. That is, the teeth remain almost closed, and the patient cannot open and close their lower jaw. In this case, we can clearly identify the problem based on the patient's tomography and direct X-ray films, and the fused bone in that area. By removing a piece of bone and creating a new joint through surgery, we can definitively solve this issue. Another surgery we perform is jaw extension surgeries, known as distraction osteogenesis, applied to the jaw. Patients are generally very interested in these surgeries, especially due to the name of these jaw extension surgeries. However, the distraction method we apply here is not suitable for every patient. The primary aim of this method is, particularly during childhood years, to address deformities in the jaw. In these surgeries, we place an apparatus inside or outside the mouth on the jawbone and extend the jawbone by 1 millimeter per day as much as needed. To use this distraction method, the jaw extension method, in adult patients, there must be a specific indication. Not sufficient for the patient's conventional jaw surgery operations, so that we can plan and consider a jaw extension surgery. Just like in childhood, we can place the device in adults and extend the jawbone by 1 millimeter per day as desired. This, as I mentioned, is a method we apply to patients with severe bone deficiency and significant deformities, and the results are quite successful. In any case, regarding deformities related to the jaw, some of them have only an aesthetic aspect. But I want you to know that some need to be done for functional reasons as well. From both perspectives, my team and I, especially in issues related to bite, work together with my orthodontist colleagues to achieve our excellent results. Whatever your problem may be, my team and I can successfully solve it and make you happy.